Welcome to Tocilizumab Chronicles Beyond the Cytokine Storm, where we explore the intricacies of tocilizumab and its role in medicine. I'm your host, Dr. Shikha Agrawal, and as always, I'm joined by Prachi Virat, our microbiology and bioinformatics enthusiast, in this last episode on tocilizumab in practice in context to real world insights and expert perspectives. Welcome to the show, Prachi. Can you believe this is our wrap up episode?
I honestly can't, Dr. Shika. It's been such a rewarding and insightful journey exploring Tocilizumab from so many angles with you.
Same here. And for this last conversation, we are focusing on what happens in the real world beyond clinical trials. Prachi, can you share any real life examples or stories that highlight how tocilizumab works in actual clinical practice?
Sure, Dr. Shika, it's a great question to start with. In rheumatological clinics, we have seen patients with refractory rheumatoid arthritis unresponsive to multiple treatments, achieving significant symptom relief within week of starting Tocilizumab. One such example that comes to my mind is a patient who went from barely being able to dress herself due to severe joint pain to resume daily walks within 2 months. In COVID-19 ICU setting, tocilizumab has played life-saving role in managing severe cytokine storm, with some patients stabilizing within 24 hours to 48 hours post-administration, improving oxygenation and inflammatory markers rapidly. These practical experiences often reinforce what the trial suggests, but also reveal nuance in patient response.
Thank you for those examples, Prachi. It really grounds the science in the live patient experience. So, what factors do you think contribute to successful treatment outcomes with tocilizumab?
Excellent follow-up, Dr. Shika. Success with tocilizumab hinges on early identification of suitable candidates, careful monitoring of inflammatory markers, and patient adherence. Managing expectation, adjusting dose based on pharmacodynamics response, and proactively managing adverse effects like infection are also key. Multidisciplinary collaboration, especially in COVID-19 care, has been a major function in optimizing outcomes as well.
Really insightful, Prachi. Thank you. How can clinicians tailor tocilizumab treatment to suit individual patient needs?
Great question. Personalizing tocilizumab therapies involve considering patient-specific factors like infection, concurrent medication, and even social factors like access to regular lab monitoring. Clinicians increasingly use biomarkers like CRP or IL-6 level to guide timing and dosing adjustment, and there is growing interest in pharmacogenomic tools, though that's still emerging.
That's a smart, patient centered approach. Now, what are some of the common pitfalls or challenges clinicians might encounter when using tocilizumab?
Another thoughtful point, Dr. Shika, the main challenge include infection risk, particularly latent TB and opportunistic infection, monitoring liver enzymes and neutrophil counts, and managing gastrointestinal perforation risk is high in high risk group. There is also issue of cost and access to some healthcare setting. And with COVID-19 timing with dose precise and with COVID-19 timing the precisely during cytokine storm windows is tricky and sometimes debated.
Prachi, you have really unpacked those issues well. Thank you. Before we sign off, what would you say are the key takeaways from today's episode and perhaps the series as a whole?
I would say tocilizumab is a versatile, powerful immunomodulator that made a genuine difference in both chronic inflammation disease and acute settings like COVID-19. Real world data and expert experience show its values when used judiciously and in the right clinical context. And perhaps most importantly, continued research, patient centered care, and interdisciplinary collaboration essential to getting the best out of this biologic therapy.
Beautifully summed up. And that brings us to the end of our podcast series. Prachi, thank you so much for your expertise, your energy, and all the thoughtful insights you have brought to every episode.
It's been a privilege, Dr. Shika. Thank you for hosting this wonderful series and making these complex topics so engaging.
And to our listeners, thank you for coming along on this deep dive into the Tocilizumab Chronicles Beyond the Cytokine Storm. We hope these conversations have enriched your understanding of the science, the practice, and the possibilities ahead. If you've enjoyed this series, please subscribe, share it with your network, and drop us a review. Your feedback helps us grow. Until next time, stay curious, stay informed, and keep championing better patient care. Goodbye, everyone.